Another PLAB2 station was Dr. Al. So I posted a long video talking about the stations where you have to do a follow-up and you have to give test results for the patient, whether it was blood results, CT scan, chest x-ray, anything. Someone replied to me and said that in that video I picked iron deficiency anemia, and they said that I've picked a very easy topic and that it is so easy that they're not worried about it if it popped in the exam, that I should step things up a notch. I said, okay, let's go with, hypothetically, for the sake of this video, I'm gonna stick to blood, but I'm going to go with vitamin B12. This is something common, this is something important, and this is something that could possibly be a little bit troublesome for some candidates. P1, chief complaint. Why did you do this investigation? Do we really want to concentrate and waste all our time on a complaint that we already have the diagnosis? No. We want to know the complication. And in B12, we're not going to ask about palpitation and this and that. We have the diagnosis, the patient has anemia. We want to concentrate on complications relative to B12 deficiency, neurological complications, pins and needles, numbness, reduced sensation, anything like this, okay? This is the most important bit in the complications. We carry on. P12, past medical history. Alright, as I always say, in these stations, you want to find something to blame. So what are the reasons for low vitamin B12? It could be diet, or it could be autoimmune, like pernicious anemia. So in P2, in the second part of the history structure, where we want to ask about other medical conditions, you want to name them. That would give the consultant in the room the idea that you know them. You want to name vitiligo, hypothyroidism, Addison. You want to know the autoimmune disease that comes with pernicious anemia. You go to P3, diet, crucial in here. Then, do you need to ask about differential diagnosis? Of course not. You already have the diagnosis. It is a follow-up. Straight to the management bit. Is there anything in particular we want to concentrate? The follow-up. And B12 deficiency, it's very important to concentrate on the follow-up. Senior, you really don't need a senior. In sense of management, when I did my exam, it was 2 years ago, I think. So now the guidelines could change. So my advice is always check with NICE's guideline or NHS guideline and follow those. That's the only thing you need to know from the management. The 5 point that I've mentioned in my previous video, go and watch that video, and good luck, guys.